Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by SpaMedica.
So what is bruxism? Bruxism is a medical term for those patients, who tend to grind at night. They're grinders, they're clenchers, and every night they're grinding and grinding. And as a result of that impact, that force of clenching your jawline muscle back here called the masseter, you get flattening of the dental occlusal surfaces. And chronic bruxism can lead to aesthetic deformity, or call it alteration with strong jawline, which is not terribly feminine. And it can actually lead to temporomandibular joint pain, or impact, crushing, and pressure and force on the joint that opens your jaw, the temporomandibular joint, and TMJ pain. So grinding at night can lead to grinding and smoothing and sanding down of occlusal surfaces and affect your occlusion. It can lead to chronic pain and headaches, and spasm of the jawline muscle, to temporomandibular joint pain, and to aesthetic enlargement of the lower jaw, which may be okay if you're Newt Rockney or a football player and a guy, but it's not particularly feminine if you happen to be a woman. So what are the treatments for bruxism or nocturnal grinding? Well, the first is to often see your dentist about the occlusal surfaces, and they notice that you're a bit of a grinder and you have a thick jaw, maybe long before you have TMJ pain or masseteric hypertrophy or muscle overgrowth, and they'll give you a nocturnal splint. A nocturnal splint will protect the grinding, so it'll save your dental surfaces, the occlusal surfaces, but it won't stop the ongoing hypertrophy of your jaw or the impact force on your temporomandibular joint. And so it'll help with the dental sequela and outcomes of grinding, but not the enlarged masseter or the temporomandibular joint. So as you move up in the options, the next and most effective is the least invasive option is Botox into the masseter. Just like we can use Botox to relax muscles that over frown or over squint, we can inject into the masseter and put that masseter muscle to sleep for 6-9 months, which gives tremendous amount of relief on the dental grinding. It relieves the pain and spasm of this masseteric overload and hypertrophy, and it can actually give almost immediate relief of temporomandibular joint pain. So Botox, masseteric Botox, is probably the best, least invasive, longest lasting treatment for bruxism. So who's a candidate for Botox into masseteric hypertrophy? Well, anyone who suffers from bruxism and nocturnal grinding, those that want to save or preserve the occlusal surfaces and not wear a nocturnal splint, or to be honest, a lot of people wear the splint and do Botox. For those that suffer from aesthetic, a strong jaw syndrome, where they have a very square jaw and happen to be feminine, want to look more oval. And then those that have headaches, muscle spasm pain, or temporomandibular joint or TMJ pain, those are all good candidates for masseteric Botox. Who is not a candidate for masseteric Botox? What's the contraindication? Those patients that are contraindicated for Botox. So if you have an autoimmune disorder like lupus or scleroderma or MS or ALS, it might be declined treatment. Although that's a relative contraindication. Pregnancy, you can't be pregnant, undergo Botox treatment. If you have an anaphylactic reaction proven to neuromodulators before, that would be a contraindication to treatment. And so very few absolute contraindications. Generally, Botox is very safe and very effective. And usually, almost all patients without those more extreme medical conditions are going to be a good candidate for Botox for bruxism. How effective is Botox for masseteric hypertrophy? Well, in short, very effective. So what does it do? We inject the Botox in the right proportion, the amount with a very small syringe, so the treatment's very easy, very simple to do. Often I'll use a little laughing gas or nitrous oxide to take the edge off a bit, but very, very comfortable, like a 1 out of 10 to 2 out of 10 on discomfort. The Botox is placed right into the muscle, the clenching muscle itself. It doesn't work immediately. It takes a few days to uncouple the contraction apparatus from the signal to clench. So your brain goes clench, 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 but you can't release the chemical that causes the muscle to contract. So the relaxation happens over about a week. Then you start to see some relief in the pain because there's no more spasm. You're not clenching, so you're not grinding. It relieves the temporomandibular joint pain within a week, and often any migraines or headaches or spasm within a week. So it's effective usually within a week, fully effective within 2 weeks. The longevity of that pain and symptom relief can be up to a year. What about the aesthetic improvement? The aesthetic improvement happens because that strong square jaw, the guy jaw that women don't want, takes time. It takes time for the muscle to not contract and then wither away. So the withering away takes often 3 or 4 weeks. So I tell most women you're going to be quite happy with the shape within 6 weeks. And that shape improvement, that square shape to a more feminine oval or anime shape to the face, will last upwards of a year. How quickly can you return to your activities of normal living and daily living, including work and social interactions? The answer is immediately. It's very, very unusual to get bruising, noticeable swelling after masseteric Botox. Unlike lip augmentation or under eye fillers where bruising is very common, there's virtually very close to zero risk of an adverse bruising event or some complication that may mitigate your ability to go right back to work. So it's truly one of those things you can plan over at lunchtime. Are there any deleterious or adverse events and side effects following masseteric Botox? In reality, the side effect profile is very, very safe. I've been doing masseteric Botox for a couple of decades, and if you look at the literature and my personal experience, I have not had a single serious complication or side effect. There are some mild side effects that you notice. For example, you can't chew as strongly. And that sounds great if you're a grinder, a nocturnal bruxer. However, if you have a big filet mignon and a steak, you want to chew it, you would really have to work at it because you've lost your prime grinding muscle, your clenching muscle. So one side effect is harder to chew chewy foods. So you may move towards soups and pastas and softer foods because chewing down on very gristly foods, vegetable matter is much more difficult. But most women are happy with the aesthetic outcomes, so they'll live with that side effect. Sometimes one muscle is more relaxed than the other. You have to come back for a little touch-up. That's uncommon. Rarely, and this goes down to the skill of the injector, the deep injection hits the wrong muscle, and some asymmetry in your smile or something may happen that's untoward. In my practice, that doesn't happen because I know where I'm injecting, but it can happen. It is reported, so you got to be cautious about who you select as your injector. But very safe to do masseteric Botox and very effective for its treatment goals. So does masseteric Botox, does it work with any other treatments? So there are complementary treatments that can give a better aesthetic result. Well, most of the women I see may have bruxism, may have dental grinding, they may have TMJ pain, but they do it to look better. They do it to look better. So we want to shrink the masseter to make it more oval. So quite often, I'm combining masseteric Botox with fillers in the upper cheek to give that cheek sweep. So we take a boxy face and do this with fillers along the zygomatic arch or malar eminence, masseteric Botox, maybe a little filler support in the corner of the mouth, lip augmentation, Botox to the corner of the mouth, Botox brow lifting, and maybe some energy-based treatment, fractional technologies, tightening technologies to tighten the skin and improve color. So the big three are Botox, filler, and energy-based devices, complementing a return to a more oval, youthful look. So is there any maintenance with masseteric Botox, and what is the nature of that maintenance, and how long does it take? The masseteric component of your rejuvenation will last upwards of a year. So generally, you shrink down your clenching jaw masseteric muscle once a year to keep that oval shape. The other components of your multimodal treatment, like the energy-based treatment, the Botox for your brow and other areas, you have to do twice a year. But for the masseteric component, once a year. Generally, it's going to take about 45 to 60 units per side if you've got a very big masseter, and from 25 to 30 units if you have a modest maxer. So you have to look at pricing for your masseteric hypertrophy and the Botox treatment to be somewhere between 30 and 120 units, depending on how many units you need to control that masseter. The number one risk is under Botoxing and thinking it doesn't work on me. So some people may only use 15 or 20 units in a masseter. It needs 45 or 60 units. And it's not that it didn't work, it's that they didn't use enough. So make sure you go to an experienced clinic where the physician or physician delegate has experience and they use enough to put your masseter to sleep. And then you have to do it once a year to maintain that beautiful result. What is the cost for masseteric Botox? Well, it depends on how big your masseter and how much Botox is required. But on average, 45 units, and 45 units being the most common amount of Botox you need for a large masseter overgrowth, and that would be 90 units. So the doctor pricing typically across North America is around $10 per unit. So it's about $1,000 to shape your masseter for 1 year. Now, if you combine that with the energy-based treatments like photofacial, fractional, bulk heating oil, and Botox elsewhere, you usually pay less the more you do. But just masseter Botox in general would be about $1,000 average cost. Now some clinics might be $800, some might be upwards of $1,500, $1,600, depends on the physician. You might need 60 units in each masseter, and that's 120 units, that might cost you more. So that would be the average range per unit as expressed in the masseteric Botox treatment. Generally affordable, an affordable treatment cost for the huge benefit: facial shape, TMJ pain, muscle spasm, migraines, and dental occlusion. So thank you for joining me, Dr. Stephen Mulholland, here in Toronto, Canada, on Plastic Surgery Talk for our latest installment of our podcast series, this one on Botox for masseteric hypertrophy, or the treatment of bruxism, a very specialized use for Botox, but a very valuable and potentially a life-changing event for patients. Again, if you found this interesting, educational, and entertaining, please share this, subscribe, and comment. See you next time.